Hi, my name is Zach Bitley, and welcome to my developmental workshop titled Empowering Adolescent Amputees Gross Motor Skill Training Through Physical Therapy. The purpose of this presentation is to provide you, other physical therapists, with information and abilities needed to provide and work with adolescents, specifically adolescent amputees in physical therapy, with an emphasis on motor skill retraining methods. First, let's talk about why it's important and why we need to understand and relate to adolescents who are amputees. First, they have very unique challenges that they face. Oftentimes, obviously, that other kids don't face, and it makes them feel left out or different. So, just understanding that unique way that they are. See themselves and other people see them as well. Another thing is learning strategies for motor skill retraining in adolescence. Obviously, after losing a limb or any other prosthetic gaining of prosthetic limbs, you have to retrain or relearn how to do basic movements like walking, picking things up, and just the things in the like of that that they already knew how to do before, but now they have to learn how to do a whole nother way. Another thing is developing proficiency and implementing physical therapy interventions tailored to each individual adolescent amputee and what they need, because each one of them is going to have a little bit different of an approach or situation that they're in that's not the same as another kid or another amputee that's just like them. Another thing is gaining insights in a holistic approach to not just their physical but also their psychological and emotional aspects. For example, a psychosocial support that they need just to feel accepted and emotionally supported in their situation. And finally, fostering confidence in working with adolescent amputees and their families and just the people who are close to them. That's going to help us as physical therapists promote their well-being and independence. Next, we're going to talk about the definition description of amputees. It's ICD-10 CM diagnosis code Y83.5, which is amputation of limbs as the cause of abnormal reaction of the patient or of later complication without mention of misadventure at the time of the procedure. Basically, it's just major limb amputation. And we're talking specifically about adolescents, so for the ages of 10 to 18. Here are my research articles. The first one is titled Prosthesis Use is Associated with a Reduced Physical Self-Disgust in Limb Amputees. This study by Burden and his team investigated the relationship with prosthesis use and the physical self-image of amputees. The researchers sampled 100 individuals with limb loss. They found that prosthesis was associated with lower levels of physical self-disgust. So that means that gaining a prosthetic piece of equipment helps amputees feel better about themselves or just have a better confidence in their own physical self confidence. And this study just helped also show that it's beyond just the functional improvements, it's also with the psychological improvements of amputees and with adolescents in a time where a lot of things are confusing or hard in life, and just their brains still developing. They oftentimes have trouble being confident in themselves and just finding ways that they can gain this confidence is super important. My second research article was titled "The Prevalence of Osteoarthritis, Higher Risk with Transfemoral Amputation, a database analysis with 1,569 amputees and matched controls," so the same amount of control subjects. This research team, obviously they analyzed a lot of amputees, and their findings indicated that osteoarthritis was at a potentially a higher risk. So they had significant results showing that osteoarthritis in individuals who have undergone transfemoral amputation had a higher risk of obtaining osteoarthritis. This is often associated with their changes in lifestyle and just physical changes that happen after becoming an amputee, because a lot of times their gait will change, the different mechanics on their body, the joint loading is different because their body's off center, and if physical therapy isn't correctly utilized, a lot of times they will continue to decrease their flexibility and strength and obtain osteoarthritis at a much earlier age. So physical therapy is very important as soon as amputee subjects can receive it. So for adolescents, that can be super important. My third research article was titled "Motor Skills and Cognitive Benefits in Children and Adolescents, Relationship, Mechanism, and Perspectives." This study done by Shi and Fang explored the relationship between motor skills and cognitive benefits in children and adolescents. Overall, they found that motor skills do play a crucial role in cognitive functioning, and it's very important for adolescents, amputees, to receive physical therapy and aid, and as well as motivation for relearning the skills that they have to learn, such as walking and running, if possible, or picking things up, throwing, and the like. Just those things will improve their confidence and overall improve their cognitive function, abilities, and confidence. Fourth research article titled "Effectiveness of an Evidence-Based Amputee Rehabilitation Program, Pilot Randomized Controlled Trial." This was a team of researchers working with Oxford University, and they conducted a controlled trial to evaluate effectiveness of an evidence-based amputee rehabilitation program, which is also called EBAR, and the study assessed the impact of the program and how it related to physical function, mobility, and quality of life in individuals who underwent physical rehab. Basically, the EBAR, or the rehabilitation program, showed very significant results in improving functional mobility, balance, and prosthetic use compared to the control group, which received just regular care after surgery and had to do physical therapy on their own. So physical therapists play a very important role in the improvement of function in amputees, and overall the learning and the just help of how they can improve their quality of life. My last research article was titled "Does Targeted Nerve Implantation Reduce Neuronal Pain in Amputees?" This article I was just kind of looking for a article that talked about a specific struggle the amputees had, and how it could be aided. A lot of times, amputees will have neuroma pain, which is like nerve pain in the end of their at the end of their stump, if you will, but like wherever they have received amputation, and it's just a phantom pain or just nerve ending pain that because those nerves are severed. But this study looked at the results with nerve implantation, targeted nerve implantation, and if it helped with pain, and it showed that 87% of subjects who underwent the nerve implantation surgery actually became free of their pain. So it's a pretty cool study. It's just something I wanted to research as well. Important info. Basically, physically, adolescents have a lot of challenges related to the fit, and because they have a lot of growth and during the development of this stage in their life, a lot of times the biggest physical changes happen in this stage of life. I would say in most cases the biggest physical changes happen in this stage of life in terms of growing taller and puberty. Everything happens kind of in this stage, and just having to upkeep with prosthetic devices, changing sizes and things like that is just a hard thing for them to do oftentimes. So just being up to date with those things is very important. Next, cognitively, it's very hard to cope with becoming an amputee for a lot of people or adolescents because of their self-image and just how they see themselves with a different body than others, and just being able to encourage and build confidence in within them, and just help them to just build that outside of not only their private physical therapy sessions, but just into the entirety of their lives is very important. The social emotional aspects, having peers who have also undergone similar or the same surgery or amputation of limbs as another adolescent is important to have around, because just having a peer that has also experienced the same grief and loss that adolescents can relate to. It's just a great thing, and it will help with their confidence to be involved in more activities and just boost their confidence overall. Spiritually, it's just really important for any adolescent or any person in general to have a spiritual guide, and as we know, that is Jesus Christ, our Savior, and He's the reason that we have a meaning, a purpose, and provide hope, and He provides hope for us. And if we are able to provide that to amputees, or specifically adolescent amputees, it can be very helpful, and really the most important thing that we can do for them is that. So that's very important. At this point, I'm going to show you a video of me just explaining some of the resources that you will need as a physical therapist in working with adolescent amputees. I'm going to show you that right now. Hi, I'm going to show you some things that physical therapists will use when working with adolescent amputees. Just some tools and things we'll use specifically for upper limb and lower First thing you'll need is a towel, preferably like a longer towel, but something that you can use around the prosthetic limb in case it gets sweaty, because a lot of times you're working hard in physical therapy, you're going to start sweating, and sweat getting in that joint area of the prosthetic, it can be a distraction and it can cause slipping of the prosthetic to come off or something like that. So just being able to clean that up with the towel, also just maybe being able to tie it around the end of the limb to help sweat not reach that area as well, could be an aid. A couple of things that upper limb amputees will need to use, specifically adolescents, just to help with like preparing for playing games or just recreational activities with other peers. Would be like using a ball, throwing it to them, having them catch it with their new prosthetic limb, whether it be catching it to their chest and then figuring out a way to throw it back to you. But just doing reps of that, or something like folding a big towel. A lot of times using a bigger object will help, and then you move over to smaller objects, but being able to fold a towel, just using their new prosthetic and just getting comfortable with it with everyday activities will be helpful. Another thing for lower limb prosthetic amputees, they have a lot of trouble walking with full steps. A lot of times they'll have a dragging step or they'll just shuffle along. They need to actively engage their hip flexors and their quads. You can do that by setting out some cones, or as I have here, shoes, but just actively making them step over the shoes, using their hip flexors and their quads, engaging them. Another thing they need to a lot of times need to work on is their stride length, so you can use those cones as markers and just have a goal of reaching those markers with every stride, as stride length is often a hard thing for them to build up to after having surgery. And then a lot of things that amputees struggle with is strength, just because they will lose a lot of muscle, and he's having to relearn all the simple things. It's hard, so just gaining strength in the areas that I struggle in is important. So using a band like this is helpful, just for movement. A lot of times you have some sit down, put it on their foot, and the therapist can hold it out here, and you can do hamstring flosses, or vice versa. Like you can do some quad flosses, hooking this up to a chair or something. But bands are used a lot in physical therapy, but specifically for adolescent amputees, using bands is a very helpful tool. Finally, I don't have one with me, but using a mirror just to place in a unilateral spot so that they can only see one side of their body. For an amputee, it's helpful because if you can just place it right here in the center, they only see one part of their body, and then ask them to do a movement that requires both limbs to move. They kind of get a mind-body connection with their prosthetic limb that helps them to just create like a connection to that, become more comfortable using that limb, and just feel more like natural with it. But overall, those are some things that physical therapists use in therapy with amputees, and specifically adolescent amputees. Right, now let's talk about some of the challenges involved with being a physical therapist and and you're working with adolescent amputees. A lot of times, physical therapists will have trouble with the prosthetic fit, physical development / rehabilitation, psychological impact, and also just the transition to the independence, which is the ultimate goal of physical therapy for the therapist and for the subject. First of all, prosthetic fit. Adolescents, as I previously mentioned, grow in rapid spurts, and it's oftentimes the biggest point of growth in their life. So just being able to keep up with proper fit and function is very important. It's also really hard. It's a challenge because a lot of times they can't go in and get a new prosthetic fitted for several months while they are still growing, and they have to work. You have to work with a prosthetist that is improperly fit, and that's just a challenge sometimes. Also, physical development / rehab. It's important to have goals that tailor to each individual patient and their amputation status. Just to be working on the specific strengths and weaknesses they're going to have. A lot of times it's going to include balance, strength and stiffness, and just assisting with that is very important, but also a very hard challenge as well. Another one is psychological impact. As Erickson's stage says, the industry versus inferiority stage, having a sense of identity and self-image and gaining that as an adolescent is hard, but it's an essential part of that stage in life, and just the added challenge of being an amputee can be very hard to cope with, and just being a physical therapist and helping them gain confidence is super important for this stage of life. And finally, just transition to independence. Obviously, that is the main goal of physical therapy, and it's just super important for the physical therapist to not only push their push the people they're working with in the field, in the clinic, but also just help them to gain confidence and be able to care for themselves outside of it as well, as they navigate to their new life as amputees. Now I'll talk about the joys and benefits of being a physical therapist and working with amputees. One of the biggest things is witnessing progress. I've seen this firsthand as I have worked with amputees before, specifically an adolescent amputee, and each time that they see progress in themselves and they hit a goal, it's super cool for them, but it's also super cool for the therapist to see this, and just be able to reaching those milestones one by one is it's a very cool thing, and it builds a lot of confidence. Another thing is just building a meaningful relationship. As you are helping the adolescent just grow in life, you're going to encounter them a lot, and just begin to build a sense of trust with them where they just feel just safe with you, and if you are able to just build that relationship well, it's a really cool thing, and it helps promote a lot of growth, not only in the amputee but also in yourself as a physical therapist. Another thing is growing resilience. Being an amputee is super hard, but if we can help them grow resilience and just push toward their goals and the best possible thing that they can have for themselves is just being able to become independent and feel more confident and at peace where they are in this world. And even though this is a temporary place, just helping them to feel motivated and confident in who they are with their resilience is just a super cool thing to witness when that happens. So that's super cool. And then finally, just holistic care, contributing to that as a physical therapist is really cool, because you're not just helping them with their physical needs, but you're also helping them emotionally and socially to be able to become well-rounded individual and just thrive in life overall. And that starts physically, but it is really a holistic thing that applies to all areas of life. Next, I'll talk about my Christian worldview. I have two verses here, and I'll explain them a little bit. But 1 Timothy 4:12, don't let anyone look down on you because you're young, but set an example for the believers in speech, in conduct, in love, in faith, and in purity. As adolescents are developing, and they're still young, they tend to get overlooked by a lot of adults, but just being able to be bold and confident in who they are and what they believe in, and upholding the ways of God and showing that through who they are, their words and their actions, it's super important, and it is very important at that young of an age. 2 Corinthians 12:9 says, "My grace is sufficient for you, for my power is made perfect in weakness." Obviously, amputees are facing a physical disability, and that makes them physically weaker than a lot of people, just due to the trauma that they endure. But being knowing that their strength and their confidence comes from God and who He is, that He knows them, and He is good, and His grace is sufficient for whatever they need. Helps them to just be empowered to be confident in who they are, and it's just very important to remember that our strength comes from God and not from ourselves. Overall, just want to talk about the summary real quick. Physical therapists can productively work with adolescents, amputees, specifically by staying knowledgeable and learning, as the world of prosthetics is a very growing and advancing world, as we are finding more and more technology, as technology continues to develop, and just it's a very cool and interesting field to work in, but just staying knowledgeable and up to date on all those things is super important. Also, due to the stage of development adolescents are in, being as a physical therapist, being able to help adolescents feel like they're in control of their rehab helps a lot with their identity, and as we previously mentioned, the industry versus inferiority stage and Erickson's stages. This allows adolescents to gain that sense of control of their own life, and just their own physical life, but also just the overall life that they lead. Being able to set goals and encourage adolescents to reach their goals is very important, and it's where they're going to develop that resilience that I talked about through the recovery process. So just being able to set goals and helping them set goals is very important. And finally, taking a holistic approach in all these scenarios, especially with adolescents and amputees, is super important. And even though it's a tricky thing to do with their development stage, focusing on physical, cognitive, emotional, and spiritual well-being is very important. Specifically spiritual, it can be hard to do sometimes if you're working in a workforce that is secular, but any way that we can encourage and just show the love of God and Jesus Christ through our work is super important, and just being holistic in our care to everyone, not just in the physical domain where we physical therapists focus most of our talents in. And these are my sources.